Okay, it's on.
My name's Spencer, and I'm going to do I just got a requisition for a complete knee. I'm going to grab my film. I'm going to use a 10 by 12, starting with the AP knee. And I'm going to set my technique here. I'm going to go turn off the photo timer, get this down to about 10. It's a female patient, so bring my film over here, set my position down. The film in the buggy. The green facing to the top. Detent my tube. And just leave it where it is so the patient can sit down. I'm going to come over to the Fuji and set up for a complete knee, which looks like I have already done. I would enter in the patient's ID and then press OK and press complete knee. All these will come up. I'll go grab my patient. Michelle Brown. Okay. Is there any possibility that you're pregnant?
No.
Okay. What's your birthday?
9/30/85.
And who's your doctor?
Dr. Gaynor.
Dr. Gaynor? Okay. Go ahead and lay down on your back for me.
Okay.
Open this up. So what happened to your knee? You fell?
Yeah.
Okay. How long ago was it?
Like 2 days ago.
Alright. How'd you fall?
I was playing hopscotch.
Hopscotch?
Yeah.
That sounds like fun. And it's your right knee?
Yeah.
This is where I add an angle to my tube. And I'll go ahead and put my marker on here. Coming down. Hold on. Hold still there. And X-ray. Go ahead and grab my thumb out. You can relax. Scan it and run it. And then grab a new film. Next I'm going to do my oblique. It's going to be an internal oblique. So can you go ahead and roll your toe inside? Right there. And send it once again at the apex of your patella. Move this aside. Okay, hold still there. I'm going to go up with my technique just a little bit. And X-ray. And then I'm going to run this film under an oblique technique. And run that. The next film I'm going to grab is a 14 by 17. I'm going to set my technique as a sunrise. Can you go ahead and bend your knees up just slightly for me? Right knee, but I'm going to get both of them in this one. Okay, I'm going to have you reach up and grab a hold of this film here. Trying to get both the film and the tube matching. I have my tube at 105 degrees, and these, I'm going to bend them down just slightly, right about there. Okay, hold still there for me. Go ahead and shoot my x-ray at 70/10. Grab my film from me. And run this on the sunrise here. Scan it and run it. Next film I grabbed was an 8x10, and I'm going to grab a sponge from it. Just hold still right there, okay? Now I'm trying to get the tube perpendicular with your tip fib, and I'm going to scoot this back as far as I can. Scoot the film back as far as I can. And once again, my central ray is perpendicular to the tip fib. Okay, hold still there. And I'm going to do a technique of about 70/12. X-ray. Grab my film. Run it. Scan it. Run it. Set my technique for a lateral, which will be my next one. Are you comfortable there?
Yeah.
Okay, can you roll over onto your right side for me? Putting my tube at about a 7-degree angle. Detensing it. Go ahead and roll your left knee over your right, and then bend your right knee. Right there. And the center, right where the knee joint is, so at the medial condyle of the femur. Okay, and toes up and heel down. Good. Can you roll back just slightly with your hips? Make sure she's in a perfect lateral. Hold still there. And x-ray. Okay, you can roll to whatever position you're comfortable with. We should be all finished. And I'm going to run this film as a lateral. Okay, we're all finished. Now we have evaluation criteria for the knee. This is our AP knee. And for this one we want to see open joint spaces. And the patella is superimposed over the femur here. We also see the fibula and the tibia partially superimposed right here, which means that there's not too much rotation. We also want to see these intercondylar eminences here and make sure that there's some soft tissue present. Now we'll move to the lateral. Now on a lateral knee, we want to also make sure that we have the condyles superimposed here, and that we have both tibial plateaus. Those should be superimposed also. There's also an open joint space, and the patella should be in a complete lateral position, and it should not be, there should be an open joint space. The patellar femoral joint space right there should be open. We want to see the knee at a 20 to 30 degree flexion, and the fibula and tibia should be slightly superimposed over one another, which they are. Okay, here's our AP oblique medial rotation knee. We want to make sure that the tibia and the fibula are not superimposed right here. We also want to see an open knee joint, so it's fairly open right there. The patella should be beyond the medial side of the knee. We want to see some soft tissue, and we want to see both tibial flaps. Okay, here's our intercondylar fossa view called the Baclaire. We want to make sure that our intercondylar fossa is open and that we see both the intercondylar eminences here. There's no superimposition of the patella and the fossa, so the patella you should see right up there. And we want to see slight tibiofibular overlap, so this section here, to make sure that there's no rotation. Here's our bilateral patella view, the sunrise, also called Setagast method. We want to make sure that our patella is in profile here and that we have an open patellofemoral joint space. We also want to see the surfaces of the femoral condyles, so these sections right here, and we want to see some soft tissue in there.